Good evening, everyone. Welcome to the Healing from COVID-19 webinar. I'm Dr. Jyoti Patel. For those of you who don't know me, I practice integrative internal medicine and pediatrics here in Scottsdale, Arizona. I'm also board certified in functional medicine, mindfulness, and Ayurvedic lifestyle instruction. So tonight, it is my mission to empower you with knowledge so that you can take back control of your health. We're going to start by really just a simple disclaimer about this webinar. This webinar is for information purposes only, educational purposes only. It's not intended to substitute for professional medical advice, diagnosis, or treatment. It's for you to assume responsibility for how you choose this information. It is my hope that you will discuss these tools with your doctor and partner with them in your health. So what to expect for tonight? Well, in this webinar, we're going to talk about SARS-CoV-2, the coronavirus, and I'm going to share with you some natural ways to treat acute and long COVID by doing three things: decreasing inflammation, boosting energy, and improving immunity. So as you might remember, back in December of 2019, there was a novel virus that was identified in Wuhan, China. And then by March of 2020, the World Health Organization had made an assessment that COVID-19 was characterized as a pandemic. And from there, we were on Operation Warp Speed to produce a vaccine. And by the end of December 2020, we had our first COVID vaccine. We thought that we had overcome a lot of what we were going through. Unfortunately, in 21, we started to see emergence of variants. We saw the Delta variant in June, and then we saw the Omicron variant in November. We got our first oral treatment for COVID-19, Paxlovid. And so we thought, again, here we are, maybe we're over the worst of it. And by August 3rd, 2020, there have been over 6.4 million deaths reported worldwide from COVID-19. So where do we stand today? Well, as of July 28, 2022, nearly 88% of the United States population is in either an area that has medium or high cases of COVID-19. So though most of us may feel like we have immunity, either through natural infection or vaccination, the problem has been that we've seen these new variants emerge, which is triggering resurgence, new outbreaks, and this leads us to unpredictable implications, needing new prevention and treatment strategies. And that's where I come in today. All right, so we have a patient named Jay, and Jay wakes up one morning feeling a little malaise, feeling a little backache, a little tickle in his throat. The next day, he starts to have some sweats and some fever, and now he has a sore throat, and he might start to have some runny nose and cough. So just, with a show of hands, how many of you have felt this in the last 2 years or can relate to these symptoms? Now, as Jay goes on, he starts to feel a little tired, headachy, body achy, fever. So what does he do next? Well, like most of you, Jay takes a home COVID test. And lo and behold, his COVID test is positive. You too may have experienced this. So now you have a COVID test that came back positive. What do you do next? Maybe you call your doctor and you look for options for treatment. Now, currently, we have three options for treatment. The conventional medicine has oral medications that they can prescribe, something called Paxlovid, or you can get an injection or IV with a monoclonal antibody. Or if you're seriously sick and have severe symptoms, you might get admitted to the hospital. So Jay calls his doctor, and his doctor says to him, well, has it been 5 days since the onset of your symptoms? And of course, Jay has to be greater than 18 years of age and has to have more than one risk factor to qualify for this Paxlovid oral medication. He also has to make sure that he doesn't have any serious kidney or liver problems. And this medication is contraindicated with statins and hormones and blood thinners. So not everybody is eligible for the oral medication. Now, Jay may qualify for the monoclonal antibody, but again, he has to be high risk for complications and within 7 days of his symptoms. Lastly, he may decide that he needs hospitalization based on the severity of some symptoms. So if he's having a change in mental status, vomiting, diarrhea, abdominal pain, chest pain, or he's at risk for complications, his doctor may put him in the hospital. And his doctor may, if he does get hospitalized and has complications from COVID, see some of these lab findings: low white blood cells, low lymphocytes, low platelets. His liver may be affected. His inflammation markers may be elevated. Clotting factors may be abnormal. There may be complications with his heart, his liver, his kidneys, his nervous system, vascular system. So there may be complications. But what happened with Jay was he didn't really get to medical treatment on time, either because he was past the window, his doctor didn't prescribe, he didn't have a doctor, or maybe he didn't qualify. Maybe you can relate to that. So with a show of hands, if you've been in that picture where you've been left to fend for yourself. Poor Jay, right? He now has COVID, and the only advice he gets is supportive care. He doesn't know where to go. So you may find yourself in that same picture. Now, the amazing thing that I want to share with you guys is that your body has superpowers. So Jay's immune system has been designed and perfected over millions of years to hunt, find, and destroy pathogens that might affect his survival, just like you. And he's the best of his ancestors could have hoped for, just like you. And through his ancestors' experiences and challenges, his system was designed for survival. So I'm here tonight to show you what are the factors that will help you heal and survive through COVID. Are you guys excited? Hopefully you are. So the 3 ways that I want you to think about healing from COVID, whether you have it now, whether you had it weeks or months or years ago, and you are still feeling the effects of it, think about decreasing inflammation, boosting your energy, and creating a strong immune system. Yes, that is how we can take treating COVID to the next level. So I'm going to start with the simple one, decreasing inflammation. What are some of the ways that you feel inflammation in your body? Maybe thinking about all the symptoms. The sore throat is inflammation. The cough and congestion is inflammation. Sinus congestion is inflammation. Brain fog is inflammation. Your backache, your body aches, all of those things are inflammation. So when we're tackling inflammation, guys, doctors are finally learning that one of the best ways to reduce inflammation is not in your medicine cabinet, but it's in your refrigerator, okay? So ways to decrease inflammation: 1, take away foods, chemicals, activities, stressors that cause inflammation in your body. Your body's already inflamed from the virus. Why pour more fuel in the fire? Number 2, there are foods that have anti-inflammatory properties. I'm going to go over all of those things so that you can really fortify your medicine cabinet, your refrigerator and pantry with these tools. And lastly, of course, you want to restore balance with good lifestyle habits, such as sleep and stress reduction, which also can affect inflammation. All right. So first step is an integrative approach to inflammation. What are the things that you should remove from your pantry and fridge? Sugar, refined flour, ultra-processed grains, sodas, processed hydrogenated oils, packaged food, fast food, fried foods, processed meats, high salty snacks like chips and French fries, and factory-raised animal products. Basically the standard American diet, right, guys? So unfortunately, through COVID, people have become complacent with their diet. They're going to comfort foods, processed foods, convenient foods, DoorDashes, and this is actually making the system more vulnerable to inflammation. So I recommend cutting out the cigarettes and decreasing the alcohol. Again, 2 factors that might increase inflammation in your body. Read the labels. Read the ingredients on your packaging. High fructose corn syrup, artificial sweeteners, chemicals, fillers, binders, additives, dyes, preservatives, pesticides, BPA, parabens, thickeners. Think of these agents as causing more inflammation, keeping you from feeling your best. You want to kind of replace all of those agents with fresh fruits and vegetables, beans, legumes, whole grains. Try choosing healthier fats, seeds, nuts, avocados. fish, whole soy, Asian mushrooms that have a lot of medicinal properties, maybe even adding in garlic and onions that have allicin, like an antioxidant, gingeroids, and turmeric, which has cucamoids, and cinnamon. These agents, these herbs and spices and food agents help fortify the body against inflammation. Green and black tea, cloves, oregano, basil, mustard seeds, all have medicinal properties to act on the pathways to mitigate inflammation. So put that in your arsenal. Now, in addition to what you should replace and remove, think about restoring some things that can help decrease inflammation. Did you know that sleep deprivation is associated with markers of inflammation? Okay, like cytokines, you've heard of the cytokine storm. Well, sleep deprivation makes that cytokine storm worse. And sleep is critical to the effective functioning of your immune system. When we go into Delta, which is that deep sleep, that's when our immune system comes alive. So when we sacrifice sleep for that ongoing scrolling on social media and that Netflix series after series, we're actually sabotaging our ability to decrease inflammation. Obesity. We now know through the last 3 years that one of the highest groups that are at risk for having severe COVID are those that have obesity. This accumulation of abdominal fat causes excessive release of inflammatory markers. Okay, these pro-inflammatory markers put that patient in an inflamed state already. And so when we're sedentary, when we're not active, when we have an accumulation of weight over the last 2 years, that actually increases our risk for inflammation and prolonged COVID. So work on that weight loss because that can actually help mitigate your risk. Lastly, chronic diseases. We know diseases like hypertension and heart disease and diabetes, along with autoimmune diseases, are directly correlated with increased risk for severity and mortality from COVID. So one of the things that I work with my patients on is helping them moderate, decrease their risk for disease with nutrition, sleep, exercise, stress reduction, and connection. Now, you might say, okay, I'm doing all of those things, Doc. What else can I do? What else is in my arsenal to decrease inflammation? Well, interestingly enough, there's a functional medicine approach as well. It's been shown that this particular virus activates something called an NLRP3 inflammasome, okay? And when it activates this inflammasome, it causes a cascade of uncontrolled pro-inflammatory cytokines leading to that cytokine storm. Here's something really important. There are things that we know in your diet that can shut down the cytokine storm because they inhibit this inflammasome. Okay, so this may be new information. I want you to really absorb this. If there's a pro-inflammatory process happening because of the virus, there are things in your food, in your diet, that are potent inhibitors of this pathway. Resveratrol, curcumin, ECGC, quercetin, and melatonin. Okay, so these I've put in the notes here, but those of you that are watching the webinar now or later, you will receive a PDF from me, a gift, a booklet that has all of this information in it with all the dosages. Okay. Now, in addition to supplementation, there are foods that you can add into your pantry and your fridge that can help you get the vitamins, minerals, and agents that have also been studied to help shut down viral replication, viral entry into the cell, and inflammation cascades. Okay, so food is your arsenal. Food is medicine. It's connection. It's information. So add this tool into your tool belt. Vitamin C rich foods, vitamin D rich foods, also sunlight, vitamin A in your dark leafy greens, zinc in your pumpkin seeds, omega-3 fats in your salmon, fermented food like sauerkraut and kefir and yogurt, selenium in your Brazil nuts, and quercetin in your onions and apples. So If you don't have these foods available to you, try to bring them back into your pantry and your fridge, because they are potent anti-inflammatory agents. Now, there is an Ayurvedic approach to inflammation as well. Ayurveda is a 5,000-year-old Indian healing tradition. And doctors 5,000 years ago would teach their patients how to balance disease with food, with movement, with meditation, with yoga, with breath work, with self-massage. And here's a few things that you can add to your arsenal. You can decrease the heat, the inflammation in your body by driving down stress, physical heat, anger, resentment, hostility, criticism, resentment, judgment in the mind and body, because these energies will actually make inflammation worse. And you might be acquiring these emotional states through social media, watching the news, talking to people that have different belief systems than you. So try to mitigate that, that energetic heat that might be making the inflammation worse. There are some natural botanicals in Ayurveda that can help with inflammation in the soft tissue, like turmeric, ginger, ashwagandha, boswellia, and holy basil. I like to add all of these into teas, so they're easy to acquire throughout the day. If you have brain fog, another supplement in Ayurveda called Bacopa has been studied and shown to help with focus and memory. You may already have a regular practice of yoga and breath work and self-massage, meditation and exercise, but know that studies have shown that they can reduce inflammation in the body. Here's another piece of information that I find fascinating. Your circadian cycle can also help you mitigate inflammation and promote immunity. What does that mean? If you can set a regular time when you wake up and a time when you go to bed, it really can help enhance your body's regularity and help you fight infections better. So try to do that in your day. Try to keep a regular schedule with your sleep-wake cycles. Connect with yourselves, your family, your community, and nature. So now the second step to healing from COVID is boosting energy. How many of you have had COVID and have had that prolonged fatigue, that end of day drag, that post-workout shortness of breath, breathlessness, depletion of energy? Oftentimes, it's not just COVID that causes it. We've seen this phenomenon of chronic fatigue syndrome with other viruses like Epstein-Barr. And patients that have been affected by a chronic infection sometimes get dismissed by the medical community or prescribed an antidepressant. But I'm going to show you some new ways to stimulate the production of energy in your body if you're suffering from post-COVID fatigue. Are you guys excited? All right. So first step, an integrative approach to boosting energy. First is aim for acceptance. Oftentimes we're on this treadmill of doing in our life, and we just want to get it over with. We want to get back to our workouts. We want to get back to work. We want to spend energy without really trying to heal. So my first advice to you is, when it comes to energy, be patient with yourself. Don't compare your energy level to the energy level of others or how you used to feel when you were 20. What's more important is accept where you are right now and give yourself what you need at this moment in this time. Kindness and compassion. Now, also, if you want to bring energy up, start looking for things that make you feel alive. Maybe you start journaling during this time to see what was it that made you feel good in life. Maybe it was exercise. Maybe it was being with your friends. Maybe it was being alone. Maybe it was sleep that you really needed. So rest when you feel depleted. And most of all, have patience and self-compassion. Energy is a commodity. You have to earn it. And I'm going to show you a few ways how to do that. So going back to the 5th grade, if you remember, your science teacher taught you that in the cells, the mitochondria is the powerhouse of the cell. They're like tiny little batteries that make energy we call ATP. And our body basically runs on ATP. And many people feel weak, and lack of energy after they've been infected with a virus like COVID. And this may be because the mitochondria stops making as much energy because of the damage caused by the virus. Okay, so they'll talk a little bit about how the mitochondria gets affected by the virus. Studies show that the SARS-CoV-2 virus hijacks the mitochondria, okay? And then it starts using the mitochondria as machinery to replicate copies of itself, and thereby impairing the mitochondria's ability to do both cell death, which it's programmed to do, to help protect the cell from viruses, which the mitochondria can't do anymore. And most importantly, it shuts down the production of ATP or energy, so the mitochondria can't work for us anymore. And these damaged mitochondria, they produce a lot of oxidative species. They start breaking down. They start affecting iron storage. They start affecting clotting factors. And they also stimulate the production of cytokines. Again, that word keeps coming back up. So knowing that this phenomenon is happening when you have SARS-CoV, that's affecting the production of energy, and it's stimulating more inflammatory cascades to happen. So your question to me is, how do I help my mitochondria make more ATP, right? Well, here's a few ideas. Studies show that you can actually stimulate the health of your mitochondria by doing intermittent fasting. Now, most of you have heard that term before, but those of you who haven't, let me walk you through it. So you start eating your meals at 8 a.m. and kitchen closes at 8 p.m. So you try to eat within an 10-hour or 12-hour window, so that way you're fasting for that 12 hours overnight. So you eat from 8 a.m. to 8 p.m., you fast from 8 p.m. to 8 a.m. Now, if you're feeling a little stronger in terms of your energy and you can narrow your feeding window to 10 to 6, that's even better. And if you don't feel like you can do that every day, maybe pick 2 days a week that you can do intermittent fasting. You might notice a slight increase in energy when you do that. Another agent that can help the mitochondria is something called urolithin A. It's found in pomegranates, okay? And when your gut microbiome breaks down the pomegranate or the pomegranate juice you just consumed, the bacteria will make urolithin A. And studies show that this urolithin A encourages mitochondrial growth, okay? So you can either get it as a supplement or consume a little pomegranate juice if you're trying to boost your energy. Another way to stimulate the mitochondria, guys, is cold plunges. Now, I am a resident of Arizona. I love the heat. Cold is not my friend, but I do something very simple in the morning. After I finish showering, I turn the dial to cold for the last 30 seconds of my shower to get that nice cold burst of water to stimulate my mitochondria, to give me that dopamine release, to help me get more energy. So if you're suffering from low energy, try a cold plunge. Another way to stimulate the mitochondria is through exercise. When we do high intensity interval exercises, or we maintain muscle mass, and we have strong blood vessels, this actually keeps our mitochondria alive. So now you might say, well, I don't have the energy to work out, doc. That's fine. Start slow and go as quickly as you can, and then bump it up. And then if you don't feel like that's a good place, bump it back down. Be kind to yourself. Another thing that affects mitochondrial health is your blood sugar. Studies show that diabetes, prediabetes, elevated blood sugar creates a cascade of inflammation that can cause rapid mitochondrial decline. So if you are monitoring your blood sugars, make sure that you have a tight control of your sugar, because that will also help you preserve your mitochondria, which, remember, makes energy for you. Now, a lot of times patients want supplements, or they're interested in supplementation. I mentioned this before, but with any supplementation, please always consult with your doctor first. There are key nutrients that can help support the mitochondria and help the mitochondria make more energy. Acetyl-L-carnitine, CoQ10, alpha lipoic acid. Some of my favorite nutrients to help support the electron transport chain so that the mitochondria can make more ATP. Also, powerful antioxidants like resveratrol and NAC and vitamin E can help decrease the damage that the virus is causing the mitochondria. In our clinic, we do nutritional IVs. So if that's available to you, you may even want to get a nutritional IV treatment to help support the mitochondria with glutathione, which is a powerful antioxidant to decrease those reactive oxidative species. NAD. You may have watched me on social media. I recently had an NAD drip, and NAD has been studied in long COVID to help overcome that fatigue or chronic fatigue syndrome that you get from viruses. Amino acids, vitamin C, the slew of B vitamins, and minerals like selenium, magnesium, zinc, and potassium can help with that post-COVID fatigue. Now, as we talk about other approaches, there is an Ayurvedic approach to boosting energy. In Ayurveda, kapha accumulation can cause sluggishness, lack of motivation, a heaviness in the mind and the body. And you can increase your energy through foods that are light, vegetables and fruit and salads and bitters and astringents and pungent foods can help stimulate energy. You can listen to upbeat music. You could do a vigorous body massage. You can do a yoga practice or Tai Chi practice or HIIT workout. Wear brighter color clothes. Do energetic breath work like the breath of fire, or get a good night's sleep. So remember, energy is a commodity. You have to earn it by supporting the mitochondria. You can do that through food, through mindful practices, through lifestyle practices, and through supplementation. So now the third factor in healing from COVID is building immune resilience. Remember what I said, that as we see more variants popping up, it's going to go from a pandemic to an endemic virus. We're going to see surges of COVID coming in and out seasonally. And so it's important for us in the long run to build a more resilient immune system so that we can recover quickly. Okay, we cannot quarantine and protect ourselves forever. It's going to require us to actually build a strong immune fortress. So, stress resilience equals immunity. It's really important for you to know this. Both acute and chronic stress causes a dysregulated, suppressed immune system. You may have noticed that when you're stressed at work, you tend to get colds and sicknesses more often. And that's not a coincidence. Your stress directly affects your ability to fight viruses. Chronic stress is associated with increased viral infection, like the common cold, and it can increase not just your ability to get the virus, but the severity of your virus or your condition. So one of the most important factors that we've learned through COVID-19 that predicted who got sick and who stayed well was prolonged psychological stress. There was a systemic review of mind-body practices such as yoga, meditation, mindfulness, Tai Chi, Qigong, relaxation, like mindfulness responses, breath regulation, which I teach a lot of people, showed in studies to have a favorable gene expression pattern that benefited immune regulation. So this is science, guys. These practices that are ancient practices now in science have been confirmed to help gene expression when it comes to immune resilience. So if you don't have a meditation practice, you don't have a breath practice, you don't have a movement practice, this may be the time to start. Remember that hydration and rest also allows your body to use all the energy that you're producing to fight that virus so you can recover quickly. So make sure that you are making rest, relax, and repair a priority. Social connection equals immunity. People overlook this because we are so caught up in social isolation, especially in the last 3 years. And social relationships have actually been shown to be significant determinant for immune health. Okay, social isolation, loneliness, bereavement, dealing with conflict, has been implicated in the upregulation of those pro-inflammatory processes that reduce immune function. So that conflict that you have with somebody on Facebook may be affecting your ability to fight a virus. So maybe thinking about how you're dealing with some of these factors. Studies also show that elderly people who are socially isolated, they already have an increased stress response and poor immunity, but social isolation further increases their risk of severity of disease. Social isolation in studies have been shown to be worse for health than smoking 15 cigarettes a day. Research also indicates that individuals that have the sense of interconnectedness have favorable gene expressions. So not only is social isolation bad for immunity, but feeling connected is good for immunity. They had decreased stress, they had increased antibody responses, they had better health outcomes when they felt connected. And in a study of 8,000 people, greater social engagement and living with other people were actually associated with lower levels of blood markers for inflammation, CRP, fibrinogen, white blood cells. Isn't that interesting? That just by living with other people and having social engagements, your system shows better inflammation markers. And in another study, there was a positive relationship between sociability, somebody who's social, and a marker for immunity we call immunoglobulin A. So lots of science to support the fact that your friend circle, your family circle, your connection will boost your immunity. Now, aside from the integrative approaches, there's a functional approach to building immunity. Here are some studies that I'd like you to know about. Intravenous vitamin C. So an IV drip with vitamin C has been shown to reduce cytokine storm in acute respiratory distress syndrome. Also, interestingly enough, people that were deficient in an antioxidant called glutathione, they were more likely to have serious manifestations of death in COVID-19, okay? And then, of course, we know there's tons of studies out there to show that zinc supplementation can help in prevention and treatment of COVID-19. I like this one, melatonin. And most people don't know this, but melatonin has been shown to inhibit that inflammasome pathway that COVID-19 causes. And one last thing that you might not know, a soluble fiber from mushrooms, yes, mushrooms, called beta-glucans, has been studied and has been shown that it can actually help your immune system with viral attacks, okay? And it helps with producing IL-10, which helps you fight off infections. So those mushrooms are actually beneficial. Now, you're going to get a handout with a lot of these things, so you won't have to memorize or screenshot or try to write things down quickly. I'll give you that so that you have it for you to review later. But another way to build up your immune system is to fortify it with these phytonutrients and these vitamins and minerals. You've seen this slide maybe before, but I'm going to repeat it again because it is so important. Make sure you're getting lots of vitamin C and vitamin D and vitamin A, vitamin C in citrus and berries and cruciferous vegetables, your vitamin D from sunshine and eggs and poultry, and vitamin A from dark leafy greens and yellow, orange, and red vegetables, zinc from your seeds and your nuts, selenium from your Brazil nuts, obviously pasteurized organic honey is good for you. Omega-3 fats can decrease inflammation from almonds and walnuts and chia seeds and flaxseed and salmon. You want to add in garlic into everything, raw garlic, chop it up, put it into your salad dressing, put it into your stir fry. Garlic is so good for immune resilience. I'm going to talk a little bit more about probiotics and fermented food later, but if you aren't taking a good probiotic or eating fermented food, know that that is key and essential to building immunity. I mentioned melatonin before, quercetin from onions and apples, and then there are some medicinal mushrooms and herbs like andrographis and astragalus that has been shown to help build up immunity. And again, I add astragalus in tea all the time. Now, the gut. And if you have heard me lecture before, or you've been a patient of mine, or you've watched any of my social posts, I'm a huge fan of talking about the gut as the seat of all health. And it's not just me, guys. Every modality of medicine, conventional medicine, integrative medicine, functional medicine, Chinese medicine, Ayurvedic medicine, all of the teachings emphasize that the gut is the seat of all health. Now, it's not just about the food that you're consuming and your macros, your protein, carbs, and fats. It's about where your food comes from. How polluted is your food? Is it sprayed with pesticides? Is it grown in unhealthy ways? Not only where your food comes from, but how did you prepare that food? Was it prepared in a stressed, rushed way? Was it prepared in a factory with a lot of chemicals, dyes, additives, preservatives, binders, and fillers? And then are you creating a plate that is full of color like the rainbow, balancing phytonutrients, balancing taste? And not only is your plate looking amazing, like this picture on the screen, but are you taking it in with all 5 senses? Are you bringing gratitude to your food? Are you smelling and looking at and touching and tasting your food? Are you slowing down with your food and chewing each bite? Or are you distracted, watching television, working while you're eating, scrolling on social media while you're eating something? That affects the integrity of your gut. Bringing mindfulness, bringing that mindset with food helps your body extract all the nourishment from that food so that you can absorb all the nutrients that are going to help your immune system. Also really important, not only what you're eating and how you're eating and where it comes from, is the body, the mind and the body. Vagal toning through breath work, through movement, restoring your mind and your body through your daily practices affects digestion. And digestion is the seat of all health. So now, one of the biggest pieces that I like to teach about when it comes to digestion, and we won't get through it too much today, and I have a full course coming up on digestion for you that I'd like to invite you to join me on. But strong digestion also equates immunity when you harmonize your gut microbiome. So many of you have heard of me talking about the gut microbiome. For those of you who don't know what that is, there's trillions of organisms, bacteria, viruses, parasites, fungi that live on and in your body. And these organisms have so much to do with breaking down food, breaking away toxins, fighting pathogens, signaling your immune system, signaling your hormonal system. They aid in the production of neurotransmitters like serotonin and dopamine to make you feel happy and calm. They balance so many factors. What studies have shown is that people that have a less diverse gut microbiome, they had more inflammation. They had more metabolic dysfunction. They had higher propensities of obesity, insulin resistance, and dyslipidemia. So if you don't take anything away from today's talk, I want you to understand the importance of your gut microbiome. Now, you might ask me, how do I improve the health of my gut microbiome? Well, it's good that you asked. These are some simple things that you can add to your pantry and fridge to boost the diversity and the health of your bacteria in your colon. Try to get about 4 to 5 to 6 cups of fruits and vegetables every day. I usually measure a cup by making a fist. A cup is about the size of your fist. So are you getting about 5 to 6 cups of fruits and vegetables in your day? Are you rotating them so you're getting a variety of different fruits and vegetables so that you're feeding different types of bacteria and you're growing a diverse community of organisms? Try to aim for 30 to 40 grams of soluble fiber every day because fiber feeds your gut microbiome. And if you don't know how much fiber you're getting in your day, which a lot of my patients don't, download a free app called MyFitnessPal. And for maybe 1 or 2 days, track your food. Write down everything you eat, and then look at the column that says fiber. Are you getting to that 30 to 40 grams? The standard American diet's typically 15 to 20 grams. So we're not getting enough fiber. So make that your goal to feed those little guys so that they can help you become more resistant to bacteria and viruses in your body. Now, you can eat fermented vegetables. So sauerkraut, kimchi, there's lots of fermented food that you can buy in the grocery store, yogurt, kefir, miso, kombucha, sourdough bread. Some people would even argue beer. And these probiotic containing food, they help your epithelial gut lining, they help the barrier, they consume the fiber that you're eating, and they spit out something called short chain fatty acids that feed your gut lining and make you not have leaky gut. So you want to make sure that you're eating fermented food, you're eating soluble fiber, you're consuming good oils like medium chain fatty acids or short chain fatty acids like butyrate that comes from clarified butter and coconut oil, so that you're fortifying your digestion. You also want to cut out anything that's going to kill your gut microbes. Added sugar, salt, high glycemic foods, excessive saturated fats. Now, this is a topic all in itself, right? So you might be excited about how to fix your gut. And I just want to invite you to continue your healing journey with me. I have an upcoming gut reset course that's releasing next week. For those of you that are watching this webinar today live or planning on watching it later, I will email you a link so that you can sign up for the class. Okay. And, in summary, thank you so much for joining me today. It is my pleasure to teach and empower you. This particular fact is my mantra. Our bodies were designed for survival. Let us nourish it with all the things that allow it to do its best. So I will open up to questions. There's a question answer area in the chat or in the screen here. I'm going to open it up on my screen. If anyone has any questions, don't hesitate to put it in the Q&A box. I'm here as your resource. So thank you again for spending this time with me tonight. I have put here a list of references for some of the nutritional supplements and some of the COVID facts and data for your information. Also, I will be sending you a PDF with a list of all the recommendations that I've made during the presentation today, so you have access to that. And you'll also be getting an invitation to join me on my course. So as we get to the end and we're wrapping up here, does anybody have any questions for me?